Hello and welcome to our podcast. I'm your host Ketri Shah, and today we are going to explore one of the most common issues affecting a whopping 85% of teenagers, which is acne. And to help us understand this concern better, today we have with us Dr. Ipshita Bhattacharya, who is an esteemed dermatologist with wealth of experience. Dr. Ipshita's qualifications are truly impressive, including an MBBS, MD, and MRCP STE from UK in dermatology. We are thrilled to have her expertise with us today to shed light on this prevalent teenage issue. So, welcome, Dr. Upshita. It's a pleasure having you with us.
Hello, everyone. Thank you, dear Hitvi, for such a nice introduction. I am Dr. Ipshita Bhattacharya. I'm from Delhi. I am an alumnus of Vardhaman Mahavi Medical College and Safdarjung Hospital. I did my MBBS and MD from Delhi itself, and now I'm working as a senior resident. Without any further ado, let's get it started.
That was an inspiring journey. To begin with, let's talk about prevention strategies of teenage acne. What holistic approaches do you recommend for preventing teenage acne?
Hetvi, this question makes me so happy because it's slightly disappointing to see not many people address acne as a holistic or lifestyle entity. People just think that it is something on the surface, bahar ki bimari hai, and people just want, not all, but a lot of people think that band-aid solutions, like you have a few pimples, you apply a cream, and it goes overnight and that's about it, and that should rectify ever having to deal with a pimple ever again. That is a very dangerous assumption to make. So going into teenage acne specifically, now most teenage acne occurs because the hormones are coming into action. They are trying to stabilize, and that is triggering oil gland activity, and that is leading to blockage of oil ducts and triggering bacterial growth. So usually new breakouts in teenage, they should go away once that hormonal axis has stabilized. So after teenage, you should not be getting new breakouts. Usually that's the case. However, lifestyle changes can play a huge part in not just regulating hormonal health, but also decreasing chances of childhood obesity, metabolic syndrome, and ending up with horrible hormonal acne later in life. So if you can spot it early and act on it early, then having to deal with the severe consequences later can really be ramified. So there are 4 factors I want to talk about, and I want our viewers to take note of. Number 1 is diet, the other is exercise and movement, the other one is sleep, and the last one is stress. So I'll quickly deal with them. I'm not a dietitian, so I'll quickly talk about the important, holistic, the broad things that you should keep in mind. And so starting with diet, the first thing is macronutrients. That is, what should you do about your carbs, your proteins, your fat, your fiber. So all of these should be balanced. You need to avoid processed food and refined carbohydrates, especially items with high glycemic index. Now, glycemic index of a food item means how quickly it breaks down into glucose and how much of a glucose spike it causes. Now, a high glucose spike creates pressure on your body to release insulin, and this insulin also acts on your oil glands to increase their activity and trigger acne. So you need to be very careful about not having steep glucose rises that you see with packaged sugary beverages and processed food and unhealthy oils. So that is one thing. The other thing is protein. Now, protein requirement, Indian diet is deficient in protein. You need at least 1 gram protein per kg per day. And especially vegetarians, please be very careful about this. Healthy fats and omega-3 fatty acids, again, very important. Nuts and seeds, fish for non-vegetarians can make a difference. And make sure to include plenty of fiber, that is fruits and vegetables. Now, dairy and milk products. This is a very controversial topic. This is a personal thing. A lot of people have issues with it. A lot of people don't. So we can't make blanket assumptions that no, dairy is bad or dairy is always, some issue, going to create some issue. However, dairy can be inflammatory for a lot of people. It is said that 60% of South Asians are lactose intolerant and we don't know it. So if you are going to deal with bad gut, you are going to end up with bad skin. And it is very important, if you think that this might be an issue for you, you can stop dairy and milk products for 3 months. See how your acne feels, see how your gut feels, and then you can restart your milk products one by one to see which one is triggering more of it, if at all. So that is for dairy. For yeah, now this is also important. Supplements like whey protein or vitamin B, they can also trigger it. So be very careful, especially teenagers who are working out. The other thing is exercise. So 30 minutes of activity that increases your heart rate is important, and preferably should include some form of strength training. That is preferred. And try to be active throughout the day, try to move. For sleep, 8 hours of regular, uninterrupted sleep is recommended. And for stress, practicing mindfulness, meditation, and seeking help of close family and friends or professionals can go a long way.
So let's go ahead. Coming to the next question, are there any specific diagnostic tests and treatment approaches that should be considered for these teenagers?
Yeah, so like I said, hormonal acne, most of the patients with just a few bumps here and there, they might not need any tests. But that said, tests are decided on a case to case basis. And if the child, it's actually very disheartening to see this, but we are seeing a lot of childhood obesity, a lot of people with acanthosis nigricans, which is actually darkening of the skin of the back of the neck, the underarms, as well as the inner thighs. And it is a sign of insulin resistance. It means either it's because of obesity, or it's because of not eating well, of not exercising, sleeping well. So then we might need to rule out insulin resistance. We might order a serum insulin fasting, we might need HOMA IR, or we might need serum IGF level. So it just depends on a case to case basis. Now I want to add a little thing about hormonal acne. So for late teens and early adults, if they are having multiple sort of deep-seated painful lumps, usually along the jawline, and they usually don't go away with the cream again because they are so deep, so the cream can't reach. And the sign would be that they do not heal properly. They heal with either a black mark, a red mark, or there is some scar. So that is a sign that you need to pick up and consider that it might be a case of hormonal acne, and we might need to probe it deeper. Now for women, a strong genetic history of polycystic ovarian syndrome, irregular menses, hair thinning in sort of this central portion of the scalp, as well as the front of the scalp, as well as hirsutism, which is hair growth on the face. All of these can be alarming signs. For men, initially we thought there is not much role of hormones, but now we have come up with a term which is known as male PCOS. And so men with having a strong genetic history of PCOS in the women in their family, they can also be prone to insulin resistance, and they again might develop hair thinning in the top of their head or in the front, and as well as hair growth on the face. So in these cases, we might need to do a hormonal profile depending on whether it's a male or a female, and then we might need an ultrasound for women for the pelvis to look at the ovaries and to rule out polycystic ovaries.
That was very insightful and knowledgeable, I would say. So now moving on to the treatment options. Are there any medications or topical treatments that are particularly effective for teenage acne, and what are the potential side effects for these?
Okay, so I'll deal with the two of them separately. We'll start with the topical treatments. So again, see, it depends on a case-to-case basis. No blanket approach fits all, but a general, just eyeballing it. If there is just oily skin and few blackheads, then salicylic acid or glycolic acid in the form of either a face wash or a serum or a gel might work. We might add benzoyl peroxide or a low-strength retinoid like adapalene, that is good for teenagers. For big pimples or lumps, we might add a high concentration retinoid, probably prescription strength tretinoin, or some antibiotic cream like minomycin, minocycline, or nandifloxacin. And if the people have a tendency to scratch and then they develop these dark marks after acne, then azelaic acid can help. And a lot of times I do prescribe a pimple patch so that it just stays there and it reminds the people not to pick at it. So that's one thing. And again, if people develop sensitive skin or if they have red marks, then niacinamide or centella can help to sort of soothe the skin and calm it down. As for side effects, yes, dryness, redness, as well as itching can happen when you first apply it, because again the body is not used to something like that. And that is how acne treatments work. They help the skin to shed, they help the pores to unclog, they help in exfoliation. So it is a sign that the cream and the treatment is working. And all of these side effects can be managed very well with a good moisturizer, a gentle face wash, and a sunscreen. And we'll discuss the skincare and what we can do later. As for medications, oral antibiotics are there, isotretinoin is there. For hormonal acne in women, birth control pills or spironolactone are there. And again, if there are features of insulin resistance, we might want to go for certain glucose lowering agents as well.
Thank you for highlighting that while taking it up. It was quite insightful. So now, why do healthcare providers often recommend combining multiple treatments like topical medication, oral antibiotics, and hormonal therapies to address severe or persistent cases of teenage acne?
Yeah, you are right. We frequently do that. So the answer lies in the pathogenesis as to why acne occurs. So there is a pore. So there is something which you call the pore on the skin, right? And it is the opening of a hair follicle as well as the opening of a the sweat duct, the sebaceous, the oil duct. So what is happening is that there is this pore and it is secreting more oil because of various reasons, and that the skin around that is not able to shed properly. It is not exfoliating properly. So the pore becomes clogged, and then bacteria starts festering into it, and it leads to inflammation. And that is what an acne is. So it would start with just oiliness. It can build up to a blackhead or a whitehead when you see that keratin, that material filled inside it. And later on, when there is bacterial growth and inflammation, and then there can be redness and a bump and a swelling. So the medication that we give, they are going to act on the various causes of acne. The antibiotic is going to help with the bacterial proliferation, and the retinoid is going to help with the exfoliation. The salicylic acid will again regulate your oiliness. Niacinamide will again regulate oiliness. Azelaic acid is anti-inflammatory. So depending on what kind of skin you have, what kind of acne you have, what severity you have, your dermatologist will do a keen examination, and they are going to tailor your treatment so that you can get a better effect with multiple treatments in a shorter time. That will also decrease your need to be on each of the treatment for a longer time. So it is going to reduce the side effects that you will get if you apply, say, retinol twice a day, or multiple times. That is going to lead to issues. So to prevent that, we do the clindamycin with retinoid, something like that, to sort of have the best of both worlds.
So moving ahead, can you discuss the role of procedures like chemical peels, microdermabrasion, and laser therapy in the management of teenage acne?
Yeah, so specifically for teenage acne, we don't want to do very invasive, very deep procedures because the skin is sensitive, and we want to avoid barrier damage. Usually, a lot of these teenagers are going out in the sun and they can't, afford to wear a sunscreen all the time, and so therefore, what we can do is that if there's just some blackheads or whiteheads, we can do an in-office extraction. If there are few resistant or painful pimples, and there is an event the other day, and the child is feeling very conscious, then we might inject that pimple, and we might also do a chemical peel to shrink the resistant, the big painful bumps, to decrease the burden it would take on the creams. So that is one thing. Once the pimples are gone, we can work on scars or pigmentation depending on what we end up with. So for scars later on in adulthood, we might deal with the scars. So we can either do peels, we can do microneedling, we might add PRP or radio frequency current, or we might add a laser. For PIH, again, we might add peels or laser depending on the kind of scar.
Thank you for that overview, Dr. Ipshita. Now, let's talk about skincare routines for teenagers considering their age. And can you recommend any specific routines that are suitable for managing acne prone skin?
This is a very commonly asked question. So in the morning, I recommend a face wash. It should be gentle, it should be pH balanced, and it should not make your skin feel tight or itchy or red as if the whole oil has been stripped off from skin. So number one is that. Number two, you have to massage it gently on the face for 30 seconds and wash it off with a soft muslin cloth or a microfiber cloth. You might use special exfoliating cleansers with salicylic acid or glycolic acid, but I recommend doing that only once a week to twice a week maximum, depending on what suits you. Make sure you do not become, too enthusiastic about it and end up with a damaged skin barrier. So be very cautious with how you're dealing with the cleanser. Number two is the cream. So if you have a medicated cream that you need to apply, do it in the morning, apply it over the small lesions that you're having. If you want to use a serum which is medicated, you can apply it all over the face. Let it sit for 5 to 10 minutes, and after that, when you're stepping out in the sun, you can apply sunscreen at least 20 to 30 minutes prior to your sun exposure. The sunscreen here should be broad spectrum. It should have SPF of at least 50, and the PA rating should be 3 or more than 3. The application, as we all know, the two-finger rule. So you have to apply this much of a sunscreen. It is almost equivalent to half a teaspoon. So make sure that the sunscreen that you have bought is something that you like. You need to apply a lot of it, and especially people with oily skin, a lot of times they don't like the finish. So make sure it is a thin gel based sunscreen which suits you. And if you have pigmentation, it is a good idea to go for a tinted sunscreen because it will camouflage sort of the spots and provide additional protection from visible light. So that is what you can do. For the night, you can start with the face wash again. If you need, you might do a moisturizer, and then the moisturizer should be thin and gel-like, oil-free, non-comedogenic, and dye and fragrance-free. Follow it up with a retinol or your prescribed.
So now lastly, these days teenagers often struggle with scalp issues like dandruff. So is there any connection between scalp health and facial acne that should be considered in treatment approaches?
Yes, so these two things are linked. Oily skin on the face appears as pimples or acne, whereas oily skin on the scalp increases risk of dandruff and something which we call seborrheic dermatitis. So they are interconnected, and it is a vicious cycle because oily skin is going to lead to dandruff, and further dandruff and oiliness over the scalp, they can trigger acne near the hairline or over the foreheads. So it is important to avoid oiling the scalp directly. If you really want, you feel your hair become frizzy and stuff like that, you can apply oil on the hair ends, but please don't apply oil on the hair roots. That is going to be food for the fungus which is festering in your in that oil that is being secreted by your scalp. So oil on the scalp is an absolute no. Number one. Number two is when you wash off the conditioner or you wash off the said oil, it is important to do it like in the front. Don't do it in towards the back, because when it comes in contact with your back, it can clog the pores on your back, leading to truncal acne. So you have to be very careful about how you do this. Number two is, again, there are certain medicated shampoos, there are lotions, there are tablets for the itching and tablets to control the fungal proliferation. So your dermatologist might recommend use of one of these.
Thank you. It was very knowledgeable step-wise answer, doctor. It was a pleasure having you with us on our podcast, and we will be looking forward for more such podcasts exploring different topics.
Thank you. It was very nice talking to you.
Yeah, thank you. And as we wrap up today's podcast, I want to thank our audience for tuning in. And if you are a healthcare professional with questions or an interest in exploring more medical topics, remember to connect with us on the MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until next time, stay healthy, take care, and see you next time.